The date is December 30th, 2017. Carolina Carbanzo is a 27-year-old woman living in Los Angeles.
My name is Carolina Garbanzo. I'm here to see my OB-GYN appointment, please.
Okay, you can have a seat.
X.
Hello, my name is Demarius Thomas, and I'm the receptionist.
Hello, I'm Dr. Mary. You must be Carolina Carbanzo.
Correct. Nice to meet you, doctor.
Alright, right this way.
Sounds good.
Hello, I am Dr. Ellie Mayer. I received my bachelor's degree in cellular biology at UCLA. I received my master's degree from Harvard Medical School, and I've done my residency at the Mayo Clinic. Currently, I'm the head of the OB-GYN department at Palos Verdes Estates Hospital in Los Angeles, California.
So, Carolina, have you been experiencing any unusual symptoms lately?
Yes, actually, just last week, I have noticed that I've been vomiting about 2 or 3 times a day. Also, this morning on the drive here, I was feeling very nauseous, as if I couldn't drive. I'd also like to note that I missed my last period this last week as well.
Okay, I'm going to order some tests. I'm going to order the blood and urine tests.
Sounds good. Thank you.
Several days later.
Hi, Carolina.
Hi, doctor.
The test results are back in. You have HIV. You have 1 week to live. Oh, my bad. Wrong patient.
Goodness. Jeez.
Yeah, so the blood and urine tests have come back positive. You're pregnant.
The date is April 14th, 2018.
Hello, how can I help you today?
Hello, I'm Carolina Garbanzo. I'm here to see my radiologist, Dr. Huff.
Okay, you can have a seat, and he will be right with you.
Thanks.
Yay!
Hello, I'm Dr. Huff. You must be Carolina.
Correct. Hello, doctor. How are you?
I'm great. How are you?
Good,
Please come this way. Your baby bump is looking abnormally large, I must say. Hello, I'm Dr. Timothy Huff, and I achieved my bachelor's degree in microbiology at Winona State. I got my master's at Oxford. I did my residency at Mayo Clinic, and I'm now currently a radiologist at Palo Verde Estates Hospital. I'm a highly trained individual. I read, diagnose, and treat the human body using x-rays and other digital images. All right, Carolina, this way. I'm going to lead you to the ultrasound. Please take a seat and lay down. Let me just turn this device on here. All right. All right, okay.
Is my baby moving? Is it moving?
Yeah, your baby is moving. This is a miracle of life. I think you're having triplets.
Oh my goodness. Are you serious?
The date is May 28th, 2018.
Jeez, I could really use something to eat, especially for the baby. Jeez, I really want to eat these. Oh my goodness, what's happening to me?
The date is June 2nd, 2018. After experiencing an intense craving for nails, Carolina decided to visit the general practitioner to see what the issue was.
Hello, Carolina. I'm your general practitioner, Dr. Marcus Yao.
Nice to meet you, doctor.
If you would, right this way.
Sounds good.
Hello, my name is Dr. Marcus Yao. I'm a general practitioner at Palos Verdes Estates Hospital. I received my bachelor's degree in cellular biology from the University of Washington, Seattle, and I actually attended Stanford Medical School to receive my graduate degree, and I currently work in Los Angeles, California, and I provide generalized care to patients and refer them to specific other fields of medicine to treat their various illnesses. So tell me a bit about yourself. What's been going on lately?
Well, I've been pregnant for, I've been coming up to 8 months now. And usually with my pregnancy, I've gotten a lot of hunger episodes, but this one's a bit strange. I've been having a strange craving for drywall as well as nails. So I'm extremely worried about my own condition as well as my child. So if there's anything you could let me know, doctor, it would be appreciated.
Yeah, I just have a quick. Is there anything else going on that may be different from the other symptoms you've been experiencing?
Well, there have been some issues at home with other family members that's been getting me a bit stressed out. The husband and I also have been having disputes over our children that are already at home, and that's pretty much it as well.
Well, I've seen this case once before. It's a rare disease called pica, where you really just try to eat anything that's in sight, and it's really unhealthy. So what I'm going to have you do is I'm going to have you record a food intake chart for a couple of days during the next 3 or 4 weeks or so, and I'm going to have you come back to me for a follow-up appointment to see what the issue really is.
Very good. Thank you so much, doctor.
My pleasure. The next day during lunch. The date is July 3rd, 2018. Carolina returns to Dr. Yao for a follow-up visit. Hello, Carolina. Welcome back.
Hello, doctor. How are you?
Yes, I'm okay. The more important question is, how are you? How have you been since we last visited?
Honestly, I have had yet more and more cravings for the nails and the drywall. I actually had an episode a few days ago where I just I couldn't control myself. I broke down and I ate some nails, or at least attempted to. Also, I'd like to add in that I've had a very strange craving. While I was helping the neighbor's garden, the dirt, I had a very strange craving for eating dirt, and as well as other strange things around the house.
You know, that's quite interesting. You know, all these symptoms are consistent with people who have pica, so I'm going to order a few tests for you, and we'll come back in a couple of days and see what happens.
Very good, doctor. Thank you.
Several weeks later, Mrs. Garbanzo returns. Mrs. Garbanzo, welcome.
Hello, doctor.
So have you taken the blood flow test from a few weeks ago yet?
Yes, I have, doctor. Yes, I have.
Interesting. Oh, the results are right here. Have a seat.
Sounds good. Thank you.
So, after we tested your blood, we noticed some iron deficiency and lead poisoning, possibly related, most likely related to your consumption and craving for nails. These are both symptoms of pica, so I'm going to refer you to a nutritionist to look at some dietary changes for what can help you with these growing pains. And for the second part of your disease, which is the mental aspect, pica is a serious mental illness. But I currently don't have the authorization to clear you and confirm your diagnosis. So I'm going to refer you to a clinical psychologist, and he's going to work with you on some strategies to help cope with your mental illness and overcome it. So that's what our plan. That's what our plan is going to be moving forward from here.
Thank you. Perfect.
1 week later, Mrs. Garbanzo returns to speak with the psychologist, Dr. Hawk.
So, Dr. Yao has filled me in about your illness, and he's also referred you to a gastrointestinal surgeon, so the surgeon can remove the nails and all the other harmful substances inside your digestive tract. And after reviewing your case, I think I can safely diagnose you with pica. So I know this may be very hard for you, but we will work through this together.
Thank you, doctor. Thank you.
So there's many treatment options for you. First, we're going to do several therapies. We're going to do positive reinforcement normal behaviors therapy, and we're also going to do aversion therapy. and these will just help you get over your strange urges that you're experiencing.
Very good, very good.
And because this disease is very similar to OCD. And I will also prescribe you a drug, SSRI, also known as selective serotonin reuptake inhibitors, and it's often used to treat depression, but this will help with your illness.
Very good, very good. Thank you, doctor.
A pleasure. My name is Dr. Hawk, and I am the head clinical psychologist of Palos Verdes Estates Hospital. What I do is I diagnose existing or potential psychological, emotional, or behavioral disorders. I obtained my bachelor's degree in clinical psychology from UCLA, and I went on to get my master's degree from Princeton. I did my residency at Mayo Clinic.
Hello there, Mrs. Carbanzo. I'm your nutritionist, Mr. Atkinson. So it seems that Mr. Yao has referred me to you. So let's see what we can do for you today. So what seems to be the issue?
Well, I've had strange eating habits, such as eating nails, drywall.
He did mention that, and
Oh, yes.
I believe what he said was that you had an iron deficiency, and that was the main problem that was to be addressed.
Correct, that's what he said.
Okay, so for that, I'm going to recommend some iron-rich foods, especially spinach, kale, broccoli, pumpkin seeds, bok choy, and Brussels sprouts, and those kinds of foods. And those are going to help you get your iron level up, so you don't have, and that also impacts your oxygen level. So that will help solve potential anemia, and that will make sure that your baby is healthy when it's delivered. So I wish you the best on your pregnancy. I wish you have a healthy baby, and I hope that you can overcome this mental illness that Mr. Yap previously described. Thank you.
Thank you so much, doctor. Appreciate all your help.
Hello, my name is Mr. George Atkinson. I'm a nutritionist at Palos Verdes Estates Hospital. I received my bachelor's degree from North Dakota State University in food studies. So I'm actually certified by the Academy of Nutrition and Dietetics. And what I do is I provide nutrition counseling services and also other advice to patients on what they should do to improve their daily diets.
So what is pica? Pica is a rare psychological disorder that is somewhat common among infants and decreases in prevalence as age increases. The exception being that of the developmentally disabled. The case shown in this video, that of Carolina Carbanzo, is extremely severe and very rare. Pica is characterized by non-nutritive ingestion that is developmentally and culturally inappropriate and occurs for at least 1 month. In its abnormal form, it most commonly occurs in pregnant and postpartum women.
What are its causes, and how does it affect different body systems? The disease affects mainly the digestive system, as harmful things such as nails, paint, and dirt may be ingested that poison the insides of the body. In addition, this inadequacy of substantial nutritious foods produces numerous problems for the body. Energy deficiency harms the muscular system, the skeletal system, and many of the other organ systems of the body. Pica is also closely linked with anemia and iron deficiency, especially in pregnant and postpartum women, negatively affecting the circulatory system. Psychologically, pica has been noted to closely resemble obsessive-compulsive disorder. What is wrong with me?
September 12th, 2018. After undergoing multiple rounds of therapy, Mrs. Garbanzo is healthy as ever and has delivered 3 beautiful baby boys. A few months later, Mrs. Garbanzo relaxes with one of her beautiful baby boys.
That's it, I'm done. No more.